If your blood sugar is too high, that's going to cause problems with your dental health. It's going to have an impact on your health and wellness, your insulin resistance, your immune system, and the amount of sugar and carbohydrate that you're having is going to impact on the types of bacteria that are present in your mouth and your risk for tooth decay. Now, I'm Dr. Rachel, holistic dentist. I want to talk to you about the impact of high blood sugars on your dental health and how ketosis and the ketogenic or keto diet can help you have better oral health. So I'm going to start with the science behind the keto diet and your dental health. There's a lot of anecdotal evidence and general principles of the keto diet that suggest potential benefits for your dental health. Scientific research is still ongoing to fully understand the mechanisms involved, but let's have a look at some of these scientific aspects. Well, you reduce your sugar intake and you are going to reduce your risk for decay. The bacteria in your mouth use sugar as their primary fuel source. They produce acid, and that acid erodes your tooth enamel, and that leads to cavities. Now, your pH balance, which is your level of acid to alkaline. We want to be somewhere close to neutral in your mouth, but your body doesn't want to be too acidic. The keto diet, by limiting sugar intake, helps maintain a more neutral pH in your mouth, and that reduces the risk of acid-induced tooth decay. Yes, your own saliva can get acidic, and then it can start damaging your own teeth. Well, more research is needed. There's been a link shown between low carbohydrate diets and reduced dental decay as well. If you're not feeding the decay-causing bacteria sugar, they aren't producing acid, and also they're not breeding and multiplying and putting you at risk for tooth decay. So that to me just seems like common sense. When you have high blood sugars or you eat too much carbohydrate, that leads to chronic inflammation through the body, and that will also happen in your mouth, and that is linked to gum disease. There are research studies that show that the keto diet can help reduce systemic inflammation due to its metabolic effects. Now, if you're in strong ketosis, which is where your body has been trained and has become fat adapted, and it's using ketones rather than glucose for your energy production, what happens is your body goes into this process called autophagy. Now, autophagy helps to clean up debris and dead bits and dead cells from the body, and it also helps to negate the effects of inflammation. And there's been shown that autophagy, sorry, I've always said it autophagy because that's the way I've always read it, but it is actually autophagy. It can help reduce your risk for cardiovascular disease, neurodegenerative diseases, autoimmune diseases, and cancers. One of the big benefits of being in ketosis is you become more insulin sensitive, and therefore you're not pushing your insulin up really high and causing the adverse metabolic effects that insulin resistance has. So a reduction in inflammation will benefit people with gum disease and other inflammatory oral health issues. Now, it's important that you have a healthy ketogenic diet so that you're getting plenty of low carbohydrate vegetables and salads, so kale, spinach, broccoli, green beans in moderation, but your Asian greens as well. And then you've got to make sure you're eating healthy fats. So the keto diet, your emphasis on getting most of your calories from healthy fats, and then proteins and very little carbohydrate, and that's going to provide a lot of essential nutrients for oral health, such as omega-3 acids and antioxidants. You're also going to get a lot of good minerals if you're eating things like sardines, which are a really good ketogenic food. Now, by improving your overall health, reducing your weight and reducing your risk of systemic disease and lowering insulin resistance, you're going to get an indirect benefit to better dental health. The healthier you are, the healthier your mouth and gums are going to be as well. And of course, everyone's going to have different, outcomes. So let's move on and look at high blood sugar, and dental disease, and we'll link that back to the keto diet as well. Now, high blood sugar is pre-diabetes, it's insulin resistance, it's metabolic disease, and if it's left to continue, that's going to be associated with diabetes, and that has significant negative impacts on dental health. When your blood sugar's too high, what happens is you get a weakened immune system, and that makes it more difficult for your body to fight infections, including those in your mouth. Gum disease is an infection. It is caused by bacteria. Tooth decay, yes, an infection caused by bacteria. So if you don't have a strong immune system to help defend you, then you're going to have increased susceptibility to gum disease and other oral health problems. And if you've already got gum disease, having high blood sugars is going to make it a million times worse. It's going to accelerate it, and it's going to make it harder for you to fix the problem, even with proper dental care and deep cleaning to treat your issue. So you're going to have increased risk of infections. High blood sugar increases an environment where it's more conducive to the growth of bacteria, and then you can get not only your cavities, your gum disease and periodontal disease, you might end up with oral thrush or other bacterial things going on. You can get strep throat and all sorts of things. Now, high blood sugar creates nerve damage. It damages the nerves, including those in your mouth, and that can lead to numbness and tingling in your gums and tongue, and it can make it very difficult to treat and detect oral health problems. Now, that is a rare presentation. I've had a few patients over my 30 plus years who tell me they've got altered sensations in their mouth, and it wasn't until recently that I started to become aware of this link between high blood sugars and the neurodegenerative damage. And so we've been able to link a few things together for them, and with blood tests and changing their diet, their symptoms have actually improved. A keto diet can help lower insulin resistance. Now, insulin resistance is a condition where you produce your insulin, but your cells are so desensitized to it, they're less responsive, and this hormone helps regulate your blood sugar levels. So what happens is you eat something sugary or high in carbohydrate, you produce your insulin, but your cells don't respond, so your body produces more and more and more insulin, and insulin is actually a growth hormone, so it tells you to store fat. It tells your fat cells to grow and get bigger. You can get skin tags and growths on your skin as well, because insulin is making things insulate and grow. So it helps insulin resistance in several ways. You've reduced your carbohydrate intake. The diet's emphasis on not having carbohydrate helps improve insulin sensitivity. You consume fewer carbohydrates, your body produces less insulin, and then your body can actually function more effectively. You're going to get weight loss on a keto diet. You will naturally get weight loss because your body is no longer so insulin sensitive, and the excess weight contributes to insulin sensitivity. So when you lose weight through burning up fat, you become less insulin resistant, and so your high blood sugar levels start to sort themselves out. You get increased ketones. Now, ketones are a fat, and this is an alternative fuel source for your body. Ketones help improve insulin sensitivity, and it reduces your body's need for insulin because you're not relying on insulin production to mobilize glucose to give you energy. By lowering your insulin resistance, the keto diet helps regulate your blood sugar levels, and that improves your dental health. Also, when you're not insulin resistant, you're not having this up and down yo-yo effect where you're then constantly craving sugar because everything's going haywire in your system and you can't maintain your fuel production, and you're constantly getting hungry and craving things that you shouldn't do. So there's been numerous studies that show a correlation between high blood sugar levels and the increased risk of periodontal disease, gingivitis, and other oral health issues. The Journal of Periodontology found that individuals with poorly controlled diabetes had a higher prevalence for periodontal disease compared to those who've got well controlled blood sugar levels. The keto diet's metabolic effects, including reduced carbohydrate intake and increased ketone production, improves your insulin sensitivity and lowers your blood sugar levels. It's effective in improving your glycemic control, insulin sensitivity in individuals with type 2 diabetes. It has actually been shown that a low carbohydrate diet, dropping the weight loss, reducing the inflammation, reduces the blood sugars and can reverse type 2 diabetes. Now, we've been told to lose weight, go on a low-fat diet. Fat is your enemy. Well, when you're on a low-fat diet, and I've been there, done that, it is freaking miserable. You are hungry all the time. You are tired, irritable, constantly thinking about food. You can't concentrate. You don't sleep well. You binge eat. You eat too much carbohydrate. You eat too much sugar, and you may lose weight to start with because you're getting a calorific difference, so you're burning up more than you're putting in. But eventually what's happening is you F up your metabolic system, and then as you get older you start creeping weight on, particularly around the middle, which is a sign of insulin resistance, and you can't shift that weight. You eat less and less and less and less, and you exercise more and more and more, and you just feel like you want to die because life is not worth living because you are so miserable. We should be eating high fat, protein, low carb. We should be putting our body into a state of ketosis, reducing insulin resistance, making us more insulin sensitive. And then you find that you're full for longer, you're hardly hungry. The weight naturally drops off. You don't have to push your body hard and punish yourself to lose weight. And then the weight is really easy to maintain. And look, you might be sitting there going, well, that's all right for you, Rachel. You're very slim. Yes, I am, but I have struggled with my weight since being a teenager. I was quite overweight in my 20s, then I lost the weight through exercising hard and restricting my fat. I wondered why I was sick all the time. My immune system was shot. I was a miserable bastard to be around. Pardon me being so blunt. It was not much fun, and I was obsessed with exercise, and I was always thinking about food. Then in my 30s, I gained weight. It didn't matter what I ate, how I exercised, the weight kept coming on. Now, you could say, oh, that's changing your hormones. In my 30s, a bit early. And I found it very hard. I put about 15 kilos on, which when you're only 5'3", like 160 something centimeters, that's a lot of extra weight to be carrying. And the only thing that worked for me was keto. Was putting myself on a keto diet, making sure I was in ketosis, and really swapping my diet around, going from high carb to low carb and increasing the fats and proteins. And that has helped me to keep my weight very stable and keep the weight off, and it's actually improved my health and well-being. It's not hard, but it is a lifestyle shift. Now, so I came on to talk to you about the benefits of your oral health, but really, if we can benefit your overall health, establish a homeostatic, well-balanced body, have your blood sugars under control, a strong immune system, then your risk for tooth decay and gum disease, as well as other health issues like heart disease and cancers and diabetes, just are minimized. And it's really important. You know, it's far better for you than a low-fat diet, but it takes a bit of a mind shift. I mean, you're sitting there and you're like, oh my God, I'm having all this fat. Surely I'm going to gain weight. I'm eating all these calories. Surely I'm going to gain weight. But no, your body becomes trained to become a fat burning machine, and therefore what are you doing? You're burning up your own fat. You don't need to eat so much, and you naturally lose weight, as well as reducing insulin resistance. Now, if you want to know more about how you can eat to have strong, healthy teeth and gums, then check out this video over here and do try out keto, see how you go, and let me know in the comments.